Welcome to Healthy Living. I'm Lori Johnson. Thanks for joining us today. Our topic is nursing home care, something that none of us wants to experience or have a loved one experience, but it is a necessity for many people and something that many of us have thought about, whether for ourselves or for loved ones. My guest is Dr. Carolyn Bailey Lewis, author of Love and Loss: The Storied Nature of Nursing Home Care. Dr. Lewis, thank you so much for joining us today. It's a pleasure to speak with you. We really appreciate your time and your expertise.
It's an honor to be here.
First, I wanted to tell our audience that you, because of a back injury, a benign tumor on your back, have actually spent a lot of time in various nursing homes. And so you sort of wrote your own comparison of the different nursing home experiences and also interviewed a lot of people for this book. Can you tell us why you decided to write it?
After this spinal cord tumor that paralyzed me completely in 1995, I've been in 6 nursing homes and 7 hospitals over 26 years. So after being life-flighted a couple of times, one time, Lori, my blood pressure dropped 40/10. By the grace of God, I'm still here. One time, 50/20, and I was life-flighted twice, in intensive care a lot. And after one of those life flights, when I got back to the room, I just looked up at the ceiling and I said, Lord, what? I never asked him why. I just said, Lord, what? I heard clearly, my background's in journalism and communication. I heard clearly you're a journalist. Write the story. I'm thinking, what story? You're an insider. Tell the story of what you know from an insider's point of view, a lucid insider's point of view about nursing home care to help other people. And through my pain and postponement, having gone through all of these things, came purpose. And so that's one reason why I wrote the book. I really believe that there's a reason for everything. I didn't understand it. But as we speak now, Lori, I'm still in nursing home care going through therapy and healing processes.
Well, I certainly appreciate the faith element of your book, and it's very encouraging. And I do believe also that there is a purpose for all of your suffering and for everything you've been through. And I feel that kindred spirit with you because we share the same faith, but also we share sort of the same job. You have a background in television news and journalism. So I love that. And you've worked in television stations and so forth. But getting back to the overarching issue of nursing home care. One of the things that I found most interesting about your book is you talk about how nursing home care varies so drastically from one nursing home to the next. Can you talk about, and give our viewers some idea of when they think about nursing homes? It's a very sort of a wide open question, and a lot of people are afraid. Do people need to be afraid of nursing home care?
In some cases, absolutely yes. As I said, I've been in 6, and each of them is different. Some we have pools that you can go to. Some have huge rooms with their own bathrooms. Some you're in a room with 2 or 3 people, and that's no fun. I've done all of that. And what I find is that you really have to go searching and looking. Don't just settle on 1 or 2. And I say as a recommendation, if you walk in one and you smell urine or there's a lot of dirt and it's not clean, just turn around and walk out. That means they will not take care of you. It just depends on how much help they have, how many aides, how many nurses, and there are laws about all of that. Some places abide by it, and some don't. One of the people I interviewed said, make sure it's close to your loved ones, because it's so lonely for some people who have nobody. Just look at the places, talk to people, just show up. Don't make an appointment. Just show up at a different place that you want to go to make sure it's what you expect it to be. And even though places might look perfect, every place has its warts. No place is perfect.
So when you talk about good nursing homes versus bad nursing homes, do patients always have a choice of where they go for a nursing home? And is that choice based on cost? In other words, is it the more expensive nursing home the better one, and the worst nursing home the ones that are the least expensive? Because that really does put people in a bind who can't afford very much.
Not necessarily so. What happens is if you have to go to the hospital and you can't care for yourself when you go home, the social worker will come in and say, we have these options for you. You can go here, here, or here. And that's when you have to have someone to help you. If you don't, you'll end up someplace you don't want to be. But you do have options sometimes. A lot of times it does depend on whether you have Medicare or Medicaid. If you have Medicaid, you have to get rid of just about everything that you have. And I think that's one of the laws that really needs to be changed, because you work all of your life. You end up having to get rid of having only so much money, having your house gone, your possessions gone. So yes, there is a difference in the nursing homes, and you do have a choice many times of where you want to go.
So the big takeaway is when you're faced with the possibility of needing a nursing home, you really need to check out the options that are available and maybe get some help and do a surprise visit. I wanted you to talk about some of the laws. You mentioned there are laws. Talk about some of the main laws that are helpful for consumers to know.
Some of the laws are there has to be a certain amount of staffing in nursing homes. I mean, I talked to a woman that she went to a place and there was 1 aide for 27 people. That's illegal. And some of the laws, you have rights. They give you a list of rights that you have. That you could have your own telephone in your room, and certain things the food that you have, the choices that you have, the number of aides, the number of nurses, social workers, therapy and activities. There's so many things that are required by law to be in nursing homes to help you get well and to have socialization. I used to think, well, why play bingo? My goodness, that's an old person's game. But I found myself playing it and learned that you have your own people you play with, the socialization, hand-eye coordination. So everything, there's a purpose. So there's certain activities and certain laws and certain rights that you have in a nursing home, and they are supposed to give you that list of rights when you go into a nursing home, and they have them explain that to you. Each nursing home usually has a social services department. They'll help you see you through these things.
When you are in a nursing home, you've been in a nursing home many different times. I believe every single time it was because you were recovering from surgery. I've known family members also who have spent time in nursing homes because they also were recovering from surgery. When you talk about the population of nursing homes, how many people are there recovering from surgery and who are there just for long-term care, who call that their permanent residence?
Most places have a therapy side and a long-term side. The average number of people in a nursing home ranges from 50 to about 110 or 25, and they're usually divided in half. Half of those are long-term, half are short-term. They're going through therapy. Once they get better, they talk about, they have a home visit, and then they're home, and sometimes come back for outpatient, but it's half and half in most nursing homes. Many, though, you find as the population becomes older, there are more older people in nursing homes than for long-term than short-term. But then I see where I am now, there are a lot of younger people who've had accidents on motorcycles, maybe skiing or whatever it might be, a bicycle, and they're going through therapy for short-term. And that's not so unusual these days.
Absolutely. Well, this is very fascinating information. Again, it's something that we all need to pay attention for one reason or another. We need to pay attention to. We're going to take a quick break and be right back with Dr. Carolyn Bailey Lewis. The book is called Love and Loss: The Storied Nature of Nursing Home Care. Stay with us. Welcome back to Healthy Living. We are talking today about nursing home care, and my guest is Dr. Carolyn Bailey Lewis, author of the book Love and Loss: The Storied Nature of Nursing Home Care. Dr. Lewis, before you were talking about some issues, some problematic issues with nursing homes that aren't the best. Can you talk about some good scenarios? Are nursing homes a good place for some people?
That's part of the love. When you have lost so much and you come to a place where you hear the aides and the nurses saying, I love you, or let me do your hair, that's common in a lot of places where they really care about you and they become family. And when people pass away, I've seen aides and nurses cry because they've lost a family member. But yes, there are some good ones that have excellent physical therapy, excellent activities. The nursing home, some of them where I've been, They go out on visits to Walmart or to different stores, to the Dollar Tree, whatever it might be, to shopping, and that's therapy, to socialize and to help them to become more integrated with the outside community and not isolated in a nursing home. And musicians come in and all sorts of things. So there are some really good ones, but the ones that aren't don't have many activities. They just think bingo is the only thing. But the nursing home residents want more. And those are the ones that are the better nursing homes, where you feel the love and you know that all is not lost because you gained another family member. And that's what's important for nursing home care.
I noticed that you paid particular attention to therapy dogs, and you just love those, nursing homes that have those. Can you talk about that a little?
We had a wonderful dog named Angel. Unfortunately, Angel passed away in the house fire. But she had a sense of when people needed her, and those who would let her come in, she would just go and lie by the foot of the bed and just be there for them. So it's interesting that they can sense the needs of people and sort of just hang around and go to different rooms and just make sure that everyone's all right. And it's that special sense that the therapy dogs have, and they're trained to be that way.
Have you ever known people who didn't want to go into a nursing home? They couldn't really care for themselves at their own home, and they didn't really have anybody to care for them, but they really just wanted to stay at home, and then ended up going to a nursing home and was really glad that they did.
Yes. One lady, I remember, her story is in my book, Daylene, and she said she did not want to come. She didn't want to leave her things. But when she got here, she said she didn't even get out of bed for a while. But once she learned the people and the activities and the therapy, she said, I'm doing so much better than I would have done at home. So that's a case where you find that you don't want to go, but you know you can't take care of yourself. She was having falls and didn't want to break her hip. Finally, they brought her into a nursing facility, and she did great. And that's usually what happens. And you still miss your surroundings from home, and you miss the people who you've been around for many years, your neighbors, your friends. But you gain new ones and new things to do and new skills that you learn that you didn't think you could do before.
What is some of your advice for people who are going to be moving to a nursing home to make the experience more enjoyable and more beneficial for the patient?
The first thing that my daughter did for me is she brought me pictures of my family. You go into a bare room and there's nothing. And every time I would look at those pictures, I would say, I've got something to fight for here. Because, see, after that spinal cord surgery in 1995, about every 5 or 6 years, I felt myself, I would have a setback. My hands would get weaker. And one Thanksgiving, I was trying to cook and dropping everything. My daughter said, what is going on? Finally, she found me slumped over. Went to the hospital for a month, and they did a lot of tests on me. Found that I had something called it was an autoimmune disease, and it was striking me about every 6 or 7 years, 5 or 6 years. So they adjusted my medication. So that's why I ended up back in so many nursing homes, because I would get weak and have to go back to what I was doing. But yes, there are people that find that it's just really hard to maneuver, and you have to find something that connects you back home, that gives you encouragement that I can do this. I can do this therapy. I can get out of here and get back to my regular life. Or if it's long term, that I'm going to do the best I can here with what I've got.
I've actually had two very close relatives spend time in exactly the same nursing home, believe it or not. And one had a wonderful experience and the other was totally miserable. And the one who had a good experience said it was because she forced herself to socialize and to go to all the things with people. And the other one was just unhappy about being there and really never made the effort. Can you talk about the importance of sort of forcing yourself to get out there and meet new friends?
You have to. My first 2 years in nursing homes, I was so sick, I hardly got out of bed. I was going through that every time. I was having just a reduction of my strength and on the wrong medication, sick. I even had a feeding tube. They would crush my medicine up in pudding. I can't eat pudding now because of that taste that I still smell when I see some pudding. And I had bleeding on the brain, had so much going on, and the life flights, of course, that I hardly got out of bed because I was so sick. But let me tell you about this moment. My daughter asked me one day, she said, "Mom, have you given up?" And I was so weak, I couldn't even respond. She was saying, "Say Jesus." I was so weak, I could hardly get the words out if I did at all. She left, came back with about 5 or 6 women. And one of them is a community stalwart, elder in the community, wonderful spiritual mother. And she walked in that room with those other women. She said, "You shall live and not die to declare the works of the Lord. You shall live and not die to declare the works of the Lord." I wasn't eating. She said, "By Sunday, you'll be eating." Am I living? Am I eating? I look pretty good, right? So the word that you shall live night, that's what turned me around. So after that, I knew I had to get up, had to do therapy, I had to go to activities. I wasn't doing anything. I was so weak. And that makes the difference in whether your state is good and whether you heal or whether you just stay where you are. And I see it every day. And I kind of think there's some people that really don't want to go home. They could get to a nursing facility and like the comfort. They get the meals every day. They don't have to clean or cook. And they won't do therapy because they know if they do therapy, they'll get better. But you have to socialize and make yourself do so that you can get better and be a blessing to your family and to yourself.
Absolutely. Wise words. All right, we're going to take another quick break and be right back with Dr. Carolyn Bailey Lewis. The book is called Love and Loss, The Storied Nature of Nursing Home Care. Stay with us. Welcome back to Healthy Living. We're talking about nursing homes, and my guest is Dr. Carolyn Bailey Lewis. And Dr. Lewis, a lot of us started really being afraid of nursing homes during the height of the COVID-19 pandemic. Can you talk about what type of an effect that had on nursing homes?
It was scary. Many times you would hear and because they come and close your door and wipe the handles off, and you're wearing the mask and everything. You can't go out of your room for 14 days. And then those who had dementia or Alzheimer's or any kind of memory problems could not understand why their loved ones couldn't see them anymore. They felt abandoned, and then you could only see your loved ones out the window. My son was in town for almost 2 months, only saw him out the window. And that was just really, really hard. Over Thanksgiving during the pandemic, there were 5 people at one time who passed away. You could see their demise little by little because they felt like no one loved them. And so it was really rough. You would think you were getting through it, and then they come and start closing the doors and cleaning again. Just this facility where I am was really blessed because for almost a year, no one had any kind of a symptom. I asked my aide one day, "How do you know when you have COVID?" He says, "When the white coats come for you." So I'd taken a shower, went to smell my perfume. I couldn't smell. I said, "Uh-oh, I know they're coming for me," and they did indeed.
Well, thank God that phase is over with. And it really, makes you realize that now that visitors are allowed in nursing homes, how important it is for people to visit people in nursing homes, even if you're not really a relative. Maybe they just go to your church.
It's crucial. I speak to a lot of students and I tell them, go volunteer. Someone needs you. They need to talk to you. They need to read to them, play music. Music is such a healing part of therapy for people who are in nursing homes, especially with dementia. So volunteer now that you can get back in, and you'll go through a little process, a training process. Call bingo numbers or whatever you can do, but it's important because you know what? There are a lot of people who live right in town that never come to see their loved ones, and that's so sad, and you can't figure out why. I think it's because people see their own mortality and they think, well, that's going to be me in a few years. So importance of advocacy and volunteering crucial to the healing of a loved one.
Absolutely. That is such a good point. Some people are afraid of nursing homes, and even if they have a loved one in a nursing home, won't visit because they need to get over that fear. And if you're not afraid of going to a nursing home, then go and visit those people who aren't getting a lot of attention. Well, we're going to take our final break and be right back with Dr. Carolyn Lewis. The book is called Love and Loss. Stay with us. Welcome back to Healthy Living, and we are continuing our discussion with Dr. Carolyn Bailey Lewis about nursing homes. And Dr. Lewis, you have been in many nursing homes because of a chronic health condition, and you're trying to raise money for other people who have chronic health conditions. Can you talk a little bit about that?
after one of those scary times for my daughter, she thought maybe I was almost out of here because of those blood pressure drops. She wanted to do something really in my memory. And so she started the foundation, the Dr. Carolyn Bailey Lewis Family Foundation, Dr. Carolyn Bailey Lewis Family Foundation. We have a website just with that name, .org. And it's for people who have chronic illnesses because she went through illness herself, of which she's been healed. And of course, I've gone through disability. And by me being in a college town, I see students who just need a little bit of help with their tuition, and she's seen people in dialysis who just need some food or transportation. So we wanted to help those people along the way and work with the university and work with the centers to make sure that they have some funds. It's not a whole lot. If it's not a whole lot, just to make sure they can get to that next step and know that someone really cares for them. So this is the Dr. Carolyn Bailey Lewis Family Foundation.
And also, can you tell people how to find out more information about this wonderful book of yours?
Yes, it is on Amazon. And this book, and I just wanted to say one line about it, it demystifies the process about nursing home care. Whether you go, if you go, do you go or not, stay home. It's on Amazon, Barnes & Noble, and some of the local bookstores in our town in Athens, Ohio. One of the local bookstores, the Little Professor Book Center. But Amazon, you can go on and get it, and I hope you do. It'll be a blessing to you.
Well, I know it will be, and I love the fact that you say it demystifies the whole idea, because a lot of people have ideas that aren't true, and so you sort of set the record straight. Dr. Lewis, thank you so much for being here today on Healthy Living. It's been a joy and a pleasure to talk to you, and thank you so much for your extensive research for this book. It's going to be a blessing to many people.
I appreciate it. Thank you so much, Lori.
And thanks to you for tuning in to this edition of Healthy Living. I'm Lori Johnson. We'll see you again next week. Bye now.